Good morning and welcome back. We are debunking myths about skin cancer this morning and showing you how to keep yourself and your family safe. Board-certified dermatologist Dr. Billy Groff is here with a breakdown on where you can get a free screening in town. And we're going to do some fun things this morning. We're going to start off with some myths and some facts about skin care and sun damage. You're going to ask me the actual question, and I'm going to try and give you an answer of what I think. So let's start off with the first one.
Okay, so our first question is going to be, the majority of a person's sun exposure occurs before the age of 18. Is that a myth or is that a fact?
I would say fact.
Fact.
Actually, that's a myth.
Oh, is it really?
Gotcha.
Number one, already down, number one.
Only about 25% of your sun exposure over your life occurs before the age of 18, so it's extra important to take care of your skin after the age of 18.
Okay, because I would think as a kid you're outside more,
That's what everyone thinks.
Maybe?
Yeah, it's actually not true.
All right, let's move on to number two.
All right, number two. Tanning beds are a safer way to get a tan.
Myth.
That is true. Tanning beds are very dangerous. They actually increase your risk of skin cancer by 75% if used just a few times a year.
Wow, and didn't those studies just come out just recently, not too long ago?
Yeah, we have lots of data on this, and the most deadly form of skin cancer, melanoma, the risk has increased 400% if you use tanning beds on a regular basis.
Wow.
That's bad.
Wow, yeah. That's great to know. Okay, number three.
Number three, you cannot get sun damage on a cloudy day.
That's a myth.
That is a myth. Actually, even if there's pretty heavy cloud cover, you can get up to 80% penetration of the ultraviolet radiation from the sun into your skin. So you still have to protect your skin on a cloudy day.
You know, it's funny you say that because my son goes out when we surf and stuff. When it's cloudy, when it's overcast, he thinks he doesn't have to wear his face stuff for that reason. But it's true, you do have to. Okay, so we're going to move on to number four. That's also good to know.
Okay, some ingredients in sunscreen can cause skin cancer.
You know, I listened to reports on this too. I would say that's a fact.
That's actually a myth.
Is it?
There's been a lot of research done on this, and there's absolutely nothing to back up the fact that any of the ingredients cause skin cancer. The FDA has approved all the ingredients, and they're 100% safe.
Wow.
In fact, you're putting yourself at risk if you don't use sunblock, because of course we know the sun causes skin cancer.
Okay, let's get to the last one. Number five.
People with darker skin, so like Asian, Hispanic, African American, they don't have any risk of getting skin cancer.
That's a myth.
That is a myth. Actually, they do have a decreased risk, but when they do get skin cancer, it's much more aggressive than the skin cancers that we see in the Caucasian population.
Wow.
Yes, you got to be. Those patients need to be screened too. So just because you have darker skin doesn't mean you're not at risk.
You're actually immune.
Yep.
Okay.
Absolutely.
All right, great stuff this morning. We're going to get you over to Chrissy because she's standing by with a couple cuties over there. So now that we know all of this, we're going to help you protect yourself. So as you walk over there, Chrissy, we're going to hand it over to you.
Yes, Dr. Groff, thank you, Brad. Come on over here. You've seen these kids before.
Yeah, they look familiar.
They're yours. Ladies, what are your names and how old are you? I'll start with you, the little one. What's your name?
My name's Piper.
Oh my God.
Piper.
Okay, what's your name?
Jenna.
Hi, ladies. Thank you for being here. So, is it Piper and Jenna?
Piper and Jenna, yes.
Okay, they're wearing some special gear. Can you talk to us about that?
Okay, well, we live in San Diego. The sun's out all the time. We take the kids to the beach. The first thing you want to do, work from the top down, is protect the face as best as you can. Now, Piper's got an excellent hat on. It's got a wide brim. It helps shadow and protect the face. Perfect. You also want to have your children wear sunglasses because, believe it or not, one of the most aggressive forms of skin cancer can occur in the eye.
In the eyeball?
Oh, absolutely.
Interesting.
And it can be fatal, absolutely. So we want to protect the eyes at all times. The clothing that the two girls are wearing are actually sun protective. This clothing provides about an SPF of 50 throughout the entire day as you wear the clothing. So, and the kids love it actually. They're nice and cool, and it doesn't bother them at all.
Where did you get this stuff?
You can get it online.
Okay.
If you just type into Google sun protective clothing, there's several options out there that are available to get this stuff.
And I'll ask you in the commercial break, how do you get them to keep their hats on? I think that's more of a behavioral kind of, I guess you can answer that. How do you get the kids to keep the stuff on them?
Well, actually, it's just like, you can use like a rewards type program. Like Jenna, my daughter, at her school, they have a reward program if they wear their hat during recess. If they get so many points for wearing their hat, then they get like a pizza party at the end of the semester.
So yeah,
there's ways you got to incentivize them a little bit.
Smart.
Yeah.
What should we have in our bags to protect ourselves?
Well, some things, of course, for sunblock, that's absolutely correct. For women, there's a lot of nice mineral-based makeups. This one, for example, provides SPF of 50.
Does that work? The powder?
Absolutely,
and all that?
it helps.
Really?
Yes.
Okay. Do you have to reapply it very often?
The powder you probably want to apply at least twice a day, like maybe halfway through the day. But you still want to use a regular sunblock underneath that powder if you can, particularly if you're going to be outdoors.
Like in your like normal facial lotion?
Yeah, yeah.
And what SPF should you use?
I would say a minimum of 30.
Are there new FDA regulations on sun protection these days?
There are. They need to be labeled now. Anything above 50 is pretty much, I don't want to say it's, it's mood. Anything above 50 is not really going to help. So it's not going to go any higher than 50.
Hi.
Careful, girls.
Hello? Is anybody home? Hello? Anything over 50 is moot. Sorry,
right,
we got
right. And they also are going to time the amount of time that the sunblock is waterproof, so 40 or 80 minutes.
Okay,
so that needs to be reapplied.
How do you know what's going to burn their eyes and what's not going to burn their eyes? Because that will make or break your day.
That is a great question. I have found this sunblock right here. It's called MD Solar Sciences. This is the one I use on my kids. My wife uses it. I can literally put this on my kids' upper and lower eyelids.
Really?
Not a factor, right, girls? You guys like this one, right?
Right. Yeah. And then the spray we don't like because it stings our eyes.
Yeah,
you don't like the spray,
sting.
even the one that say they don't spray.
They still tend to sting because they have a lot of chemicals and alcohol. This only has zinc and titanium. There's no chemicals in this sunblock.
Okay.
And there's other brands that make similar versions like Neutrogena and so forth.
Interesting, Dr. Groff. Ladies, thank you very much for.
Can I go in the water now?
Can you go in the water? I don't know. You're going to have to ask your dad that.
You can go for it.
Okay. Thanks, ladies. Congratulations. You guys did great. There's a free skin cancer screening today from 10 until 1 at the Rite Aid in Oceanside. Tonight, 6 to 8 at Cosmetic Laser Dermatology in UTC at your place.
Yes.
Oh, your office is in UTC? I didn't realize that.
Yeah, it's right on Genesee and Executive. So we're doing a free skin cancer screening from about 6 to 8 tonight.
That's a big deal. Yeah. I hope you go to that. Go to one of those. Guys, I'm gonna send it back over to you guys. Holla.
I love it. Daddy. Holla. Say it again. Holla. Yeah, buddy. Yeah, buddy. Good job, Doc. That's awesome.
Cute.
Good work.
So cute.
Oh, man, there's a highlight for you.
Oh, great.